Good morning, everyone. Thank you for inviting me to explain you our results of this study. And thank you for the premium. Okay, so this study entitled Assessment of Alpha-synuclein in Submandibular Gland of Patients with Idiopathic REM-sleep Behavior Disorder was published last year in Lancet Neurology. As you know, Parkinson's disease is a neurodegenerative disease characterized by Parkinsonism due to the loss of the dopaminergic neurons in the substantia nigra, and the neuropathological hallmark are the deposits of alpha-synuclein aggregates in the surviving neurons, the Lewy bodies and Lewy neurites. But Parkinson's disease patients have also non-motor symptoms such as hyposmia, dysautonomic features, cognitive impairment, or REM-sleep behavior disorder, RBD, that are caused by neuronal damage in extranigral regions in the central nervous system, but also in the peripheral autonomic nervous system. In the last year, several studies have shown the presence of alpha-synuclein aggregates in the peripheral autonomic nervous system in postmortem studies, but also in living patients. In particular, two recent studies have shown the presence of alpha-synuclein in the submandibular gland, in the autonomic nerve fibers of the submandibular gland by transcutaneous core needle biopsy of the submandibular glands in living patients with Parkinson's disease. Some of these non-motor symptoms of the disease can appear several years before the onset of the motor symptoms, that is the prodromal phase of the disease, and in particular, RBD, REM-sleep behavior disorder, is a parasomnia characterized by abnormal sleep behaviors with lack of atonia during REM sleep, and is caused by a dysfunction of the medullary and pontine nuclei that regulate the REM sleep. Longitudinal studies have demonstrated that most of these patients eventually develop a-synucleinopathy, PD, and also dementia with Lewy bodies. So our hypothesis was that alpha-synuclein might be expressed in the submandibular gland of patients with idiopathic RBD, and in vivo demonstration of alpha-synuclein deposit in these patients could provide evidence of ongoing disease in this earliest stage. We propose to assess whether nerve fibers in the submandibular gland of these patients contain alpha-synuclein aggregates, and we also wanted to evaluate the safety and feasibility of the procedure. We did a case control study at Hospital Clínic de Barcelona in Spain, and we prospectively recruit patients with idiopathic RBD with polysomnography confirming the increased EMG activity during REM sleep. All the patients had no motor or cognitive complaints and not any neurological disease. For comparison purposes, we also include a group of PD patients fulfilling the UK Brain Bank PD criteria, and also controls that we enroll from three different sources. First, healthy controls among friends and non-blood relatives of RBD and PD patients. Then patients who had elective neck surgery in the clinic, in the otorhinolaryngology and maxillofacial surgery services. And also we include a group of autopsy controls where patients who died at the clinic and that had an autopsy, a clinic autopsy. We review all the medical charts, confirming that these controls have no neurological diseases, no motor or cognitive complaints. The PD and the controls were age-matched with the RBD patients. In RBD, PD patients, and in healthy controls, we did a neurological assessment, including motor symptoms with the Movement Disorder Society Unified Parkinson's Disease Rating Scale. We also evaluate some non-motor symptoms, such as smell by means of the upset, constipation, and depression. And in the RBD group, we also evaluate the echogenicity of the substantia nigra by means of a transcranial ultrasound and the nigrostriatal pathway, integrity of the nigrostriatal pathway with a dopamine transporter imaging. In all the RBD PD patients and in the healthy controls, we did a transcutaneous core needle biopsy of the submandibular gland with ultrasound guidance unilaterally, usually in the right side, with local anesthetic. In the case of the surgical controls, as you can see in the picture, when the surgeon opened the neck, they macroscopically identified the gland and he did 2 to 3 core needle biopsies with the same device and in the same manner, such as in RBD and PD patients. And in the case of the autopsy controls, the submandibular gland was removed during the organ prosection and placed on a flat surface, and the pathologist did also 2 to 3 core needle punctures of the gland, and then with the same device as in the RBD and PD patients, and we also analyzed the whole submandibular gland. We did immunohistochemistry for alpha-synuclein, and we assessed the distribution of the sympathetic nerve fibers with TH immunohistochemistry. We analyzed the glandular parenchyma, but also fragments of tissue without glandular parenchyma that we call extraglandular tissue. And in the case of the autopsy controls, we also evaluate the whole brain looking for Lewy body type pathology. We did the study between July 2014 and May 2015, and we enrolled 21 patients with RBD, 24 patients with PD, and 26 controls, 7 healthy controls, 11 patients underwent neck surgery, and 8 autopsy controls. And as you can see here, we found alpha-synuclein. We found glandular parenchyma tissue in 9 RBD patients, in 12 Parkinson's disease patients, and in all of the controls. In those cases where we observed glandular parenchyma, we found alpha-synuclein deposits in 8 RBD patients, in 8 PD patients, and in none of the controls. We also found alpha-synuclein aggregates in some participants without glandular parenchyma tissue, particularly in 3 additional RBD patients, in 5 PD patients. And we also found alpha-synuclein in extraglandular tissues in some patients that were found alpha-synuclein in glandular parenchyma, in particular in 4 of the 8 RBD patients and in 2 of the 8 PD patients. We did not find any alpha-synuclein aggregate in controls in the glandular parenchyma or extraglandular tissues. Here we can see in the 2 upper rows a specimen of control. We can observe with hematosilignosin the glandular parenchyma, the ducts, and the large nerve fibers. And we can observe absence of the alpha-synuclein immunohistochemistry positivity. And here we can observe TH immunohistochemistry. In case of a PD patient, we can observe deposits of alpha-synuclein in sympathetic nerve fibers, also small coarse aggregates. And in a patient with RBD, we can also observe positive immunohistochemistry for alpha-synuclein, also in nerve fibers. With double immunofluorescence, we can observe the co-localization of alpha-synuclein in green and TH in red, in this case, in a perivascular nerve fiber. From the 11 RBD patients with alpha-synuclein, 10 had any clinical or neurological feature that we know that occur in Parkinson's disease, such as hyposmia, constipation, depression, alpha-synuclein, substantia nigra hyperechogenicity, or decreased striatal dopamine uptake. And among the 52 participants who underwent biopsy with ultrasonographic guide, we observed some adverse events, particularly in 21 patients had local pain, 17 subcutaneous hematoma, and 6 mild oral bleeding. And we observed that these side effects were more frequent in those patients who underwent 4 punctures compared with those with 2 or 3. Our findings suggest that RBD might be the promoter state of Parkinson's disease or related Lewy body type synucleinopathies. Alpha-synuclein detection could be useful for histological confirmation in individuals with clinically diagnosed Parkinson's disease. But long-term clinical follow-up of our patients with RBD will be necessary to assess the usefulness of submandibular gland biopsy in the design of future disease-modifying trials. Finally, I would like to thank all the people who made this work possible, especially my mentor, Professor Tolosa, and Professor Yelpi. Thank you.